This is a KX News special report.
Thank you for joining us for this afternoon's press briefing. I want to start out with some gratitude. We were having some streaming problems just a bit ago, but we've had a great crew that's been here every single day working through this. But I want to thank Clint Fleckenstein, Paul Teeple, and others. Way to go there in the back, keeping everything going. Let's give them a hand. Good job. And I also want to thank our TV stations, KX, KFYR, have been here every single day, and appreciate your putting this time out to help get this important information out to North Dakotans. And as always, I want to thank everybody who's watching, because you're an important part of the reason why North Dakota has been performing so well through this pandemic. I want to also say if there are streaming problems, which we've never mentioned this at the beginning, but these videos are posted at ndresponse.gov, the entire video. And so if you want to watch later, which we know a lot of people do, if you do have a streaming problem, check back in. I understand that the streaming problems are not affecting the replay capability. We've got a great lineup here today, again, from other state electeds. We got a U.S. Senator here. We got great things happening. So in addition to myself, you're going to hear from Chris Jones from Human Services, U.S. Senator Kevin Kramer, and our Ag Commissioner Doug Goring. So again, thank you to those leaders for joining us today. Good to have you here. We're going to start off with the numbers, as we always do. North Dakota Department of Health confirmed 34 additional cases of the novel coronavirus disease, or COVID-19, out of 1,924 tests. And that is our second highest day of testing. And if you, again, for those that are studying fractions at home during your schooling, 34 divided by 1924 gets you to 1.8. That is our lowest rate that we've had in some time, and it helps bring our cumulative positive rate down below 4% for the first time since April 17th. And again, that cumulative rate, that 3.9%, that is all the positives divided by all the tests since we had our first positive on March 11th. And at 3.9%, North Dakota remains in the top 5 best, if you will, which is the lowest, like golf, 5th lowest rate in the country, behind Alaska, Hawaii, who've got some unique geographic isolation. West Virginia, and then our neighbor to the west, Montana, are the ones that are there in the top 5 with us. North Dakota has also, with this great performance by our testing team, and I want to thank all the people that are involved in that testing effort, including the ones that are out doing the drive-through outbound work that we're doing, as well as those that are working around the clock on 3 shifts in the lab, that we have risen again to 5th in the nation in per capita testing, and we are not a stone's throw from 4th place. We are a sliver. Actually, it's narrower than a sliver. It's more like a micron away from 4th place, and we are chasing 4th place on that list. And I know with our team's efforts, plans through the weekend, we can get to that spot. And why does this matter, and why have we been trying to move up the leaderboard from 10th to 6th to 5th and now chasing 4th, is because, as we say, the testing is both a steering wheel and it's our compass. It's also our accelerator. It helps us understand where we are as we are driving through this pandemic storm. So again, great job to the testing team. I want to also give a shout out at the lab. Some people may think, hey, how hard is it to do 1,900 tests a day? And we're trying to build capacity to get to over 4,000 in the next month in May. But typically the lab before might have run a couple hundred tests a day across a variety of different topics. When we were doing 600 a day, that was triple the capacity, and maybe you could get to 600 a day by just adding 2 more shifts, same machinery, and finding 3 times as many people. What we've done to go from 200 to 1,900 is we tripled it, partly by going to shifts, but then during each of those shifts, we've tripled the amount of productivity that's going on. So really remarkable, but there's examples like this happening all across Team ND, across many agencies and many organizations working together to really bring unprecedented amount of capability in a short amount of time. So North Dakota Team ND or North Dakota government, again, we give our gratitude to those team members and those that have joined coming in, National Guard members and others that are really helping to be responsive to this true emergency. Next slide, next is net case breakdown. We had a slight increase in the number of active confirmed cases. I know some people have said, oh, this number is still inching up. And really, when we take a look at other states that really got themselves into a surge or a hotspot or a breakout, the active cases were doubling, and they were putting numbers out like this is the number of days it's been since the cases doubled. We are been in this very last few days just kind of bouncing around. Maybe it's possibly where we might be at the top. We don't know, but we are having a number of people recover as well as new each day, and so this edged up slightly. We do have a record number of people hospitalized, but again, that's up 2 from yesterday. Of the 30 people that are hospitalized, only 11 are on ventilators, which would be about 36.67% for those that are into math, and we have all kinds of capability, both in terms of ICU and ventilator capacity. This represents perhaps only a couple percent of the statewide capacity. So again, all of what we were doing along this time was to preserve hospital capacity. We've done that with, when I say we, meaning all of you, because your work in helping to slow the spread through your actions is the reason why we've preserved this capability. On the North Dakota case trends slide, which is, again, you're familiar, above the line is our actives, combination of ones that were existing and then the new ones in the lighter color at the very top, and then below the line in the green is those that have recovered, and we are at a record number of recoveries. We've had 458 individuals recovered, and that number also continues to climb. One thing we really pay close attention to throughout this time as we head towards trying to get our economy rolling again was the positive rate of completed tests taken over the last 14 days. So we take a look at the 14 days that have occurred most recently and the positive and negatives from those time frame, and you can see that this curve is tipping down nicely. But the other thing that's interesting about this curve is that it was basically very flat compared to all the other, not all, but many other states that had a steep incline and a steep drop. And so we continue to look at this, but our rate today, 5.4%, having a declining rate is one of the factors that the White House had for moving to phase 1. Some people have asked, boy, you haven't had a declining rate. You've had a declining rate for 5 days, not for 14 days, but you're still opening up. This is the math challenge that we've talked about before with when you have a one-size-fits-all federal guidelines for anything. To have a 2-week declining rate, it's much easier to do that if at one point your testing was in the mid-40s, which we saw in New York and New Jersey in terms of the percent of tests that were coming back positive. In North Dakota, the rate has been so low that we could be in a position where we have not had we've only had declining rate for a week. Others might have had it for 2 weeks, but yet our rate might be a third or 1/4 of some of those other states. So again, we are using the White House guidelines just as they are suggested to be guidelines, but making decisions for North Dakota with North Dakota data. One of the things that we've talked about a lot is the light touch of government and the important role of individual responsibility, and we've sort of summed that all up in North Dakota Smart, and we want to touch on that again as we head towards a number of reopenings. I know people are excited about things like getting into a restaurant tomorrow or getting their haircut tomorrow, seeing their favorite personal care individual that they may have been seeing for years. And as we do that, we want to talk about another aspect, because we've talked a lot about the important role of individual responsibility, whether it comes to being a business owner or whether it is an employee. But tomorrow this is a milestone day. Hopefully today ends a day in the history of North Dakota. Hopefully that many of you in your lifetime will never see a time frame again where we're facing a pandemic that required statewide mandated closures. So hopefully we're closing a historic era that was, well, it was dramatic. It was also relatively brief in the greater scheme of things. But as we get going tomorrow, the virus is still here. It's still present. It never left. It's not leaving with the turn of the calendar. But what we have done during this last weeks is we have developed new and strong capabilities to allow us to deal with it. But one of those new pieces of individual responsibility is the customer's role in being North Dakota Smart. And one of the things that we know, whether you're heading into a bar or a restaurant, a personal care business, again, we want you to be really super respectful of people that are working in those environments. If you're getting, and I think it's important, the business owners are checking out the new guidelines that, of course, that are posted under ndresponse.com for their ndresponse.gov for their area. But it's important that customers understand this. If you're going to go get your haircut, you may be asked to wear a mask while that is being done, or other personal care businesses. And we want you to understand that while you may think you don't need to wear a mask, you're really doing this out of a courtesy of someone who works in that industry that may be seeing dozens, or if they're working in a bar or restaurant, maybe interacting with hundreds of customers in a day. And so again, your patience, your empathy, your understanding of that matters. It's not, again, because when we say we're all in this together, because you may say that, hey, I don't think I need to wear a mask. The person that you're interacting with may have a family member that works in a long-term care situation. They may have a child that's got an immunocompromised situation. And so again, I think that one of the things of being North Dakota Smart is it has to also include a giant dose of empathy, understanding, patience, and I would even go as far as say as love towards the people, and understanding about what people may be doing and how they're trying to protect themselves. And that would mean that if you're in these situations that where businesses are opening up, again, for you as a customer, if a business says, hey, we've reached our maximum, and you see an open table, they may have reached their maximum. This isn't like the old days where, how come you're not seating me because I can see some place that's open. So it's important, again, for customers to educate themselves and do that, and again, respect those business owners that are trying to get reopened under these still difficult conditions. Of course, North Dakota Smart guidelines apply across everybody, but also apply to customers. Washing your hands, staying home if it's unnecessary, avoiding congregating in common areas when you're walking in or out, washing your hands frequently, or again, bring disinfecting wipes if you're going to the gym, or carry hand sanitizer with you if you're going to a restaurant. Another tip that's going around the country, avoid bringing unnecessary personal items into places of business. A lot of times the only thing you might need walking into a store or restaurant is simply your credit or debit card. Other items that you might bring with you that could carry the virus back out or carry it around to others, just leave it in the car. And of course, just because businesses are opening, number one rule, if you're sick, please stay home. The core tenet of North Dakota Smart versus North Dakota Tough is that people right now, knowing that the virus is still here, is you've got symptoms, please do not be at work or in public. And of course, the last thing that you can do if you want to help, you can join the 28,500 other people that have already downloaded the Care19 app. This is a tool that protects your privacy. It's available on Apple and Android, but these are the kind of tools that can help us get open and stay open. Working together, we know that we can work to save lives and livelihoods and achieve a successful North Dakota Smart restart. We put up a set of rules that are available for people, and these apply to all industries. So even if you were not a business, the 7% of employees that were under the guidelines of the executive orders, All industries, there are new protocols out there. Look for those again on ndresponse.com or ndresponse.gov. And industry-specific standards for what we call the high-contact businesses, they vary, whether you're a massage therapist, a nail salon, a bar, or restaurant. So go check out your own industry-specific standards. Again, details available online. If you were one of those businesses that was affected by the executive order, your opening time frame is tomorrow morning at 8 o'clock. And when you open, it's important to understand that the following the guidelines for those high contact businesses is a mandatory part of the reopening process. When we talked about the 8 criteria for North Dakota Smart Restart, today we checked the final box on protections for the most vulnerable. You're going to hear more about that from Chris Jones. But I just want to say, when we say we've checked the box on each of these, this doesn't mean that we've stopped. This means that we've met what we believe is the minimum threshold for us to start dialing more interaction between people in our economy. That's that sort of loosening up. Well, we're still practicing good North Dakota Smart guidelines, but avoiding large congregate facilities, because again, bars, restaurants, movie theaters, personal care can open under the new guidelines tomorrow. Large concert venues and other large events are still not under the new, will be under the new executive order, still be closed tomorrow. But as we check these boxes, again, we want to continue, as we say, to build the organizational, the infrastructure, the capability, strengthen these new muscles that we had to start developing. An example would be on testing, which we've talked about earlier, but we have planned between this Saturday and next Saturday, between May 2nd and May 9th, on outbound at 8 different locations around the state. We've got 4,330 tests already scheduled. There will be other capacity that we're going to load in to be able to do testing in response to if we have detect any outbreaks in long-term care facilities or other locations. I would also give a shout out and a thank you to our Department of Corrections. You've probably read in news across the nation about the outbreaks that have occurred within corrections facilities, and as of to date, across all the corrections facilities operated by the state of North Dakota, we've had no residents that have tested positive to date. And again, a big shout out to Leanne Birch and her team for all the proactive work they did and all the work they continue to do to protect the residents within the state's correction system. So with that, when we talk about checking the boxes here and hitting these thresholds, one of the things that we know that we've got a point where we can sort of check the box for tomorrow, but we know that there's more work that continues to do. We're going to continue to grow in our capability going forward, and that relates to the protections for the most vulnerable. And one of those areas, when we think about the most vulnerable, a lot of the vulnerable in our state are in specific housing, whether that's in assisted care, long-term care, whether it's basic care, skilled nursing, whether it's congregate housing for domestic violence, for homeless, for developmentally disabled. This is all housing. You think all of this is housing, and it's housing with supported services. And we know that this is one of the ways that to help support that vulnerable population, because housing is a stabilizing force in people's life, and having a safe, healthy place to live matters. And as a state, we're directing great resources right now towards people and dollars and energy to support housing stability during this emergency. We don't want people to fall out of the bottom, whether it's from an economic standpoint, and for those that are receiving care in the latter parts of their life, we want to make sure that we're doing everything we can to protect them. So back to talk more today about our VP3 plan, as we talk at the Vulnerable Population Protection Plan, is Chris Jones, Executive Director of Human Services. And Chris, welcome back. Happy birthday plus 1 day, and good to have you back.
So this was my birthday present, if people are wondering. Seriously, I got it from my mother-in-law, so thanks, Barb. Before I start on the housing, I want to emphasize some of the things we talked about yesterday, and one was on the VP3 program. We do have that put together. It will be on the website on ND Response. We will have specific people for you to contact regarding specific vulnerable types of population, so that will be available. The metrics we're using to drive our success going forward is when there is an individual who has been identified as COVID positive in a congregate housing setting. Within 24 hours, we will have that individual quarantined and cohorted with staff, or look at other community resources, including transfers to other care facilities that can more appropriately care for that individual. So we feel good about that metric. We are going to continue to build up that muscle to do this, because as we go on, there will likely be more. And so with that, I can't stress enough, the governor talked about it briefly. When you talk to these congregate housing facilities, visitation is one of the greatest ways to spread this into these housing settings. And people are scared, and rightfully so. And so when we talk about what we do when this opens up, please do not visit unless absolutely necessary, if visitations still allow. Please do not pressure the providers to go in there and visit loved ones. Use alternative ways to meet with them, to talk with them, to interact with them, because right now that is the #1 way in these congregate housing settings we can protect this population. But with that, do want to talk about housing in North Dakota. And right now we know there's thousands of North Dakotans who live on the edge of a housing crisis, and this pandemic only exacerbated that issue. Statistically, in a normal year, we know that approximately 10% of North Dakotans will experiencing a housing crisis within the year. So approximately 7,900 North Dakotans every year experience some type of housing crisis. There is also an often repeated statistic that 40% of Americans cannot recover from a $400 emergency in their budget. And this statistic comes from the Federal Reserve Board, and it's been off-cited, as I said earlier. In the 2017 survey, it noted that 4 in 10 adults could not withstand a $400 emergency, and over 1/5 of adults were not able to pay their current month's bill in full. And again, these are statistics during a normal economy, not today. Even if a person is working, it sometimes can be hard to make ends meet when your employment is entry level or a lower wage job. I think it's important to remember as we talk about bars and restaurants opening up, these jobs are important to our economy, but making a household budget work can be difficult in times like these. So with that, we are prepared to target federal funds we are receiving from HUD, Housing and Urban Development, to provide increased housing counseling and financial assistance to homeless prevention programs. Our goal is to prevent additional homeless. And we have also made available an emergency rent bridge and a home heating assistance program that can help households who are struggling to pay rent and utilities because of COVID. As one of the earliest components of the VP3 plan, and I talked a little bit about this yesterday, we opened a scattered site emergency shelter program to serve COVID positive, and again, it's available in 8 regions across the state. Yesterday I reported there were 35 individuals in 3 communities. Today we are at 49 individuals in 3 communities. We are eternally grateful to the partners that we've had in these communities, the homeless shelters who we've worked with, to ensure the safety and well-being of all these individuals. Additionally, homeowners who are struggling to make their mortgage payment are able to take advantage of a number of options for mortgage payment modifications, due in large part to the protections offered under the CARES Act. So the emergency rent bridge is part of a state program. Mortgage supports are part of the federal CARES program. And whether your mortgage is serviced by ND Finance, Bank of North Dakota, or another national lender, any homeowner who has a federally insured mortgage has access to a range of protections, and we would ask you to seek those out. They are available on ndresponse.gov. Housing is something that affects each and every one of us, and it's not something we often think about until it isn't there. Thank you to all the housing counselor and housing providers who work every day to make sure people have a safe and stable place to live. And again, as I mentioned earlier, the information on the rent bridge will be available on Saturday on ndresponse.gov. Thank you.
Thank you, Chris, and thanks for sticking around for the Q&A. I know it was right on the slide. I want to make one slight correction. The 7,900 is 10% of those people living below the poverty line, rather in terms of people that may fall out of housing in a given year. And again, I know that we sometimes have a stereotype when we hear the word homeless, but when you dig into that number, the bottom 10% of people living below the poverty line, and about 10% of North Dakotans are in that category. So 10% of the 10%, that can include families and children, and we know that from our work with DPI right now that we have even school-age kids who are part of families who've become homeless. So again, thanks to Chris and the team and everybody for doing their work to make sure we've got safe, stable housing, because that's the path to good health, and it's also the path to economic recovery. Next topic that we want to talk about is an introduction, which we're so excited to have here. We were very fortunate to have such a great CODEL working for us in Washington, D.C., and one of those champions who's been fighting for all this federal legislation. He's always fighting for North Dakota. You know that because he's one of the most accessible senators in America, and he's here to join us today to talk about the Main Street. Main Streets Are Hurting and the Main Street Lending Program that the Federal Reserve has just announced, and they're expanding the scope. And so again, I want to thank Senator Kevin Cramer for being here, and thanks for all you've done for North Dakota for all the years you've served our state. Great to have you here, Kevin.
Thank you, Governor, for the opportunity. Thank you for your incredible leadership. One of the things I have to say that I have appreciated most about the job lately is that I get to get on national television a lot and talk about how great North Dakota is, because everybody asks these curious questions like, how can the numbers be so low, and why don't you have all these mandates that everybody else is doing? And I just get to talk about common sense trumps government mandates every time. And when you have a governor that understands, federal guidelines and applies them to the context of the state he's running, in a common sense way with common sense people, it really works quite well. So thanks for your great leadership, Governor, as always. And before I get into the Main Street Lending Program, you may have noticed just in the last, hour and a half, CMS did make an announcement related to telehealth that I thought was great. I've been working with Secretary Azar on appropriate reimbursement for telehealth. And this is a subject near and dear to all of our hearts here in rural America, and particularly in North Dakota. But just yesterday on a phone call, we were talking about expanding telehealth services and the reimbursement, CMS reimbursement at office visit rates, not only for video conferencing, but for audio only. And so today they did announce an expansion of audio-only telehealth reimbursement at office visit and outpatient rates. So that's important not only for the patients, and it is very important for them. Not everyone yet has good access to broadband and video services, but it's also important for our providers so that they have a means of reimbursement that makes them, at least allows them to be successful. So kudos to Secretary Azar and the Trump administration on that. We've all been following for a long time, you all have been following for a long time, of course, the Paycheck Protection Program. And being a member of the Banking Committee, it was an interesting heavy lift to see that through to legislation, to finality. And now as it's been implemented, and a second tranche now has been both authorized and appropriated, to see how it's worked. And it seems like a lot of times it's felt like a moving goalposts, and that's because it has been. That's because it passed quickly. It was $350 billion in the first tranche, about $310 billion in the second tranche. God love our bankers, our credit unions, our independent community bankers, the North Dakota Bankers Association. The Bank of North Dakota, Governor, has played a leading role in organizing our institutions to the point where after tranche 1 of Paycheck Protection, North Dakota led the nation, again, no surprise, in the per capita loans. We issued 1,102 loans to the tune of just over $1.5 billion. And that results in about $140,000 per loan. So that was a remarkable feat, and that is a credit to our lending institutions. Today, well, let me back up just a little bit. I think you also all know that I've been spending a lot of my time and effort on the oil industry and the problems, the deep valley that our oil and gas, our oil independence, our energy independence, the vulnerability of it is in. And so the collapse of price and the escalating of potential bankruptcies and loss of small producers and the value chain up and down the oil and gas industries is a real problem. And on the one hand, we fought vigorously through my role on the Defense Committee, Senate Armed Services Committee, in dealing with adversaries and allies alike, particularly on the supply side. On the financing side, this is a particularly major challenge for small producers. And that's important to remember, because the one thing we do not need and do not want, the Ag Commissioner and I are talking about the vulnerability of our food supply chain with the concentration of meat packing and so few players, especially global players. Well, the same is true in the industry, in the oil and gas industry. We do not want a half a dozen oil companies surviving at the end of this and watching capital follow where capital gets the best return, as opposed to considering America's national security interests. That's where we're heading if we don't have some sort of financial credit tools to help our small producers in the value chain, upstream and downstream, survive this valley, a bridge to the other side, so that when demand comes back, and it will, and when the prices come up with that demand, and it will, that we still have some producers and some providers and some service sector companies that are still standing at the end of this. So we've been working with Secretary Mnuchin, who I talk to at least a couple times a week, I suppose, Secretary Bruyere, of course, the Energy Secretary, Chairman Powell, Jay Powell, the Federal Reserve Chairman. And this week, they've been working really, really hard on coming up with some part of the 13.3 credit tools that the Federal Reserve has, 13.3 being the emergency lending programs. One of those programs, of course, is the Main Street Lending Program. They came out with interim rules not long ago. The program fits a lot of uses for small to mid-sized companies, but not all of them. One of the challenges for the oil and gas industry is, well, there are a couple of them. One of them is the rating, the rating design in the qualifications. The rates they're setting for their rating was effective March 22nd. They had to have like a BBB- or better, which is an investment grade rating. And of course, we all know that the price war between Saudi Arabia and Russia started on March 6th. And we saw a price collapse that went from $42 to $31 in one day, and then down to $20 like the next day. And so their standing for credit worthiness was greatly diminished by this price war that is not any fault of theirs, on top of the lower demand based on, as a result of COVID-19. So that, and then the fact that the Main Street lending program also required at least 2 rating agencies to rate them at this credit worthiness level. Big problem. That basically kicks out a lot of our companies. The other thing that kicks out a lot of our companies from the other programs is the fact that they are affiliated with private equity firms, and that means that their employee base is greater than 500, even though they may only have 75 employees in the oil patch, and that kicks them out of the Paycheck Protection Program. So what's the long and short of that is, today the Federal Reserve announced an expansion of the Main Street Lending Program to encompass much more of the type of business that I'm talking about, and that is the highly leveraged business. Many of our companies, this is where a company like Whiting or Oasis, and I probably shouldn't even name companies, but companies that do business in North Dakota, smaller companies, and even a lot of the service companies, they're very leveraged. They don't have the type of cash that a very large multinational company would have. And so when they see a collapse and they see availability of credit diminished, they're in a lot of trouble. So the Main Street Lending Program they added another component that allows lenders to retain a 15% share on the loans. It's otherwise been 5%. That just makes the loans a little bit easier to do. The lenders will be able to apply their industry-specific expertise. This is a big one, because one size never fits all. And local bankers that understand the industry that they're lending to, not just industry, but the actual borrower, really, really critical. That's included in this to help measure the borrower's income. It also includes businesses of up to 15,000 employees or up to $5 billion in revenue. Previously, it was 10,000 employees and $2.5 billion in revenue. So it just encompasses a lot more borrowers. And I don't want to say it was custom designed for the oil and gas industry, but it definitely is able to capture a lot more of the oil and gas industry into these important, somewhat more benevolent funding programs, financing programs than it did previously. So I'm grateful to President Trump. He and I have talked about this many times. Very grateful to Energy Secretary Dan Brouillette, who we talk to on multiple times a week, Secretary Mnuchin, again, Jay Powell, and the entire economic team at the White House for coming up with this program that should help many of our producers stay alive till the other side when the demand and the price come back up. Thank you, Governor.
Thank you, Senator Kramer, and thank you again for fighting for all sectors of the North Dakota economy. Next up, we're excited to have our Ag Commissioner, Doug Goring. We're so fortunate in North Dakota to have an Ag Commissioner who not only understands ag, he lives it. He's back on the farm. I think when he leaves the Capitol, he's out there with all of you, understands all the trials and tribulations that ag has gone through in the last year. Today, honored to serve alongside of him and also Attorney General Wayne Stenjum on the Industrial Commission. The Industrial Commission approved some fun news today relating to the ethanol recovery program. I'm going to let Doug Goring tell you all about it.
Well, thank you, Governor. It is a pleasure serving with you and Attorney General Stenjum on the Industrial Commission meeting. We do a lot of important work, and in fact, I think something historic that took place probably in the history of this state just happened in the last 10 days. I think we've had more meetings than has ever been held before with the Industrial Commission in such a short period of time. I think this is the last of them for a couple of weeks anyways, until we have more issues to tackle. A lot on the burner. As the governor alluded to, today we passed ERP, which is the Ethanol Recovery Program. Why this is vitally important is, many of you may know, this is one of the largest value-added sectors in North Dakota. When you look at it and you look at the support that it offers, not only to our grain farmers, but also to our livestock industry, it is amazing. So if you think about it in its entirety, the ethanol industry supports about 10,000 jobs. Somewhere around 140 to 150 million bushels of corn goes through our ethanol facilities. We also look at producing about 1.3 million tons of distiller's grain for the livestock industry in a given year. When you look at its overall economic impact, even if you look at the last 3 years, on average, you're probably looking at $600 to $800 million in economic impact to the state on any given year. When prices were higher, we were definitely at the upper end of that. But it's a good program. And my thanks to the Industrial Commission members and to the Bank of North Dakota. Some of the terms and some of what this ethanol recovery program will do is provide up to $15 million to any company. It has a maximum buy down of $500,000. When you look at the 1% buy down we'd be looking at, keep in mind there is a 6-month deferred on principal and interest. After that is done, it can convert over to, and if you remember from the governor's earlier announcement about the COVID recovery program that the Bank of North Dakota passed, it will convert into that program. At that time, it'll be eligible for the 1% buy down. There is another factor to this particular program. In the 2019 legislative session, the legislature had passed the Fuel Production Loan Guarantee Program, which provided a guarantee to the ethanol industry. So it is the SIF funds, which is a Strategic Investment Improvement Fund, will actually be the guarantee behind this program. So it's got a nice backdrop to it. It's going to further the cause in helping the industry, just make it a little bit further until we can get out of this. We know it's very much linked to energy prices, and as Senator Kramer had just talked about, we know that we have a slump. We know we're trying to work through some of these things. I think probably by midsummer, at least getting into fall, maybe we'll be on the upside of this, and it buys them enough time to get back into business and get going. But with that, again, I wanted to thank the Bank of North Dakota. I wanted to thank the industry, and I wanted to thank the producers that all had some input, and I know shared a lot of that with us, and also shared it with the Bank of North Dakota, and I believe we came up with a very good program. And thank you, Governor, for all your hard work and efforts.
Thank you, Doug. And again, also, in addition to all the thank yous that Commissioner Goring just gave, I also want to thank our legislature, as Commissioner Goring said, that due to a legislation passed in 2019, it really set up the ability to do this backstop guarantee from the Strategic Investment and Improvement Fund, or the SIF fund, and that is really what's going to make this thing go. So good foresight on behalf of the legislature. Thank you again for that work. Next up, we're going to talk about the Workforce Coordination Council. And we talked about this very early on, all the way back on March 31st when we first announced it. We've had 750 North Dakotans registered at the Workforce Coordination Center, the WCC. We haven't given an update for a while, but wanted to share today that now over 200 individuals have been placed in volunteer and paid positions through this center. And we've got others that have registered that have not been yet placed, but we want to thank everyone who has answered the call to help our state and to ensure that North Dakota continues to be prepared going forward. Even as we have record unemployment claims, there are places where we need people to help. And again, particularly we're seeking individuals in the following areas: nurses, both RNs and LPNs, medical laboratory scientists and technicians, laboratory administrative support and data entry, contact tracing staff, which is included to but not limited to those with a background in public health or medical services. And again, thanks to the hundreds of people who've stepped up to help fill those jobs, including our public health masters in public health college students. Information analyst positions for epidemiology and for statistical modeling. As you've probably all learned, there's a lot of math associated with this. So again, if you've got that kind of background, go to the Workforce Coordination Center. You can find it at ndresponse.gov/help and answer the call and help us get your talents to work helping to save lives and livelihoods in North Dakota. I also want to go to next on our thing is a behavioral health, our daily behavioral health update slide. Behavioral health, we know during stressful times, maintaining it can be difficult. We might struggle on where to start and where we might find guidance. Today, we're announcing a new app from the U.S. Department of Veterans Affairs. We've talked about veterans mental health recently. This app from the U.S. Department of Veterans Affairs is called COVID Coach. Its app was created for everyone, not only veterans or service members, but if you're a family member, if you know somebody in the military, or if you don't know anybody in the military, which would be odd. But anyway, your overall health during this. It's a free app. It's used as a standalone education and self-care tool. It can supplement your own professional mental health. It's got tools for coping and tracking your mental health over time. It can walk you through exercises for everything from deep breathing to mindful walking, tools to assist with sleeping. It also provides easy access to COVID-19 resources and professional help services, and it's again available at the iTunes or the Apple and also the Google Play Store. But if you've got real issues with mental health, don't be afraid to reach out. We've got lots of resources, and you can find them at northdakotabehavioralhealth.nd.gov, and we will be there to help you again. And we've shared before all the different hotlines, but mental health is health, and in these unprecedented times, we need to take care not just of ourselves physically, but mentally. So again, thank you, behavioral health team, for surfacing this. And again, COVID Coach is the name of the app if you want to go download it. The census update is a fun one. Again, this is in the good news section. We want to again encourage everybody here to get out and complete their census. We've talked about this thing before, but this really matters. It's one of the ways you can help. Missing one resident in the state of North Dakota could cost the state $19,100 in lost reimbursements. One household, if you've got the average size household, could be close to $45,000. And if statewide, if only 1% of the state that lived here said, oh, gee, I don't need to fill out my census form, 1% of the state, that would cost us $15 million over the next 10 years. So far, we're right in the middle of the pack here in North Dakota. We've got 54% response rate. So we've got half of the states that are ahead of us, half behind us. Our neighbor to the east, Minnesota, is leading the nation with a 64.3% rate, and I don't think any of us here ever want to lose to Minnesota in anything, whether it's football or census taking. And so we need to get going. South Dakota is slightly ahead of us, just to the south, and so we've got some work to go. But we do have some bright spots, and who's on the leaderboard? Burley County, right here in the capital city of Bismarck, in this county, ranks #1 in North Dakota counties, 67.6%. Ransom County, 62.6%. Morton County, 62.5%. So congratulations for leading. But we also have another bit of a shout out where we made national news. North River, which is a small community just north of Fargo. Interestingly, that it's west of the Red River, not north of it, but it's called North River. But it's, I guess, north of Fargo, west of the river, but it's called North River. We just said that. Anyway, North River, congratulations, residents North River, #1 in the nation. 100% of the people in North River have completed the census. First and currently only city in the entire United States to complete the whole census. And April isn't even over yet. Congratulations, thank you for being counted. I'm sure that we can put other cities in North Dakota on that list along with North River. Let's see if we can get like the top 10 cities, first 10 cities in North Dakota to 100%. We can have the top 10 in the country. Final deadlines for the census have been pushed back from July to October 31st. Don't wait to get yours counted, and you can complete it online at my2020census.gov or phone in at 844-330-2020. And again, all that information that goes on there is confidential. We have a gratitude closing before we go into questions. And first, I want to thank all of our legislative leaders. Throughout this entire effort, we've had great communication, great support, great ideas, great coaching, I would even say, from former coach and now Senate Majority Leader Rich Wardner and his partner Chet Pollard, who's the Majority Leader of the House. They, of course, want to thank them. They wrote a great letter to the editor, which is out today. Also want to thank the minority leaders, Joan Heckeman and Josh Boshi from the Senate and House, respectively, for their communication and their support. And of course, there have been many committee chairs and other leaders across both houses that have been checking in regularly, providing ideas and sending in input. And we really appreciate all the support from them as we work through this historic time. Closing gratitude quote from Thornton Wilder. People may remember Thornton Wilder if you love to read, as many of us do. Pulitzer Prize winning author of many great stories, including the famous Our Town. He wrote, "The happiness of life is made up of little things: a smile, a helping hand, a caring heart, a word of praise, a moment of shared laughter. We are most alive in those moments when our hearts are conscious of our treasures." And I thought that was a good one for today as we head back out again. A shout out to all the people who maybe become customers again tomorrow, to think about those little things: a smile, a helping hand from more than 6 feet away, a caring heart at any distance, and a word of praise for those people who are back out working or have kept on working during this entire time. And again, maybe we can find a chance to look back and even find some things to laugh about as we went through this incredible time together. With that, I want to say again thanks to all of our guests today, and we'll stand for questions. And we're going to go first online for a question.
For Senator Kramer, actually.
Fantastic. Senator Kramer, you're up on deck.
Williston trending topics. Main Street here in Williston is grateful, but many small oil companies and their employees are hurting. Will Main Street lending reach the energy sector here in the Bakken, and if so, how? And can you offer any words to the thousands of energy sector workers here who are stressing?
So will the Main Street lending program reach the small energy producers in the Williston Basin in the Bakken? It is in many ways designed for them, and it's not exclusive to oil and gas, but the characteristics of the loan match much of the oil and gas sector. I won't go through all the details again of why oil and gas in many cases didn't qualify for the Paycheck Protection Program, although many did. But that just keeps you employed for 8 weeks and paid, but it doesn't necessarily get the business going again. The Paycheck, or the Main Street Lending Program provides an additional form of credit. I might back up. I didn't mention earlier, but a couple of days ago, North Dakota Oil and Gas got a lot of national news when I did a webinar with the North Dakota Petroleum Council with Energy Secretary Dan Brouillette, who talked about the forming of some sort of a lending facility, such as he referred to bridge loans. That would be probably the best description of this Main Street lending program, this expanded version. It allows small companies to get some bridge loans. I hesitate to call it benevolent capital because it is for credit-worthy companies, although the qualifications have been loosened so that more people can meet the criteria. And so that is the goal of it. That's not the silver bullet by any stretch, but we want to, again, build that bridge so the companies, the small companies, can remain in play so that when the demand and the price comes back up. With regard to what would I say to them, here's what I'd say. This is what I said to Wilbur Ross. Today I had a phone call with Wilbur Ross, the Secretary of Commerce, specific to the possibility of tariffs on Saudi Arabian oil. And we know there's a flotilla of ships, to quote some national media, full of Saudi oil prepared to come into our ports and dump their excess into our refineries. And there are many multinational companies that are willing to accept it. And what I said to Secretary Ross with regard to the possibility of an investigation for dumping, anti-dumping, and the use of 232 authority that the Commander-in-Chief, the President, has under national security auspices to issue tariffs on that oil. What I said to him, and the same thing I've said to the President many times, there are certain things in a nation, a sophisticated nation like ours, that need to be protected for the sake of our national security. One is food. That's why what Doug and I were talking about earlier with regard to the concentration of meat packing is a problem. That vulnerability has been in plain view in recent days and weeks as a result of the COVID-19. Another one is pharmaceuticals, and another one, of course, personal protective equipment. We have seen what that vulnerability and that being tied to not just foreign nations, but not very friendly nations, means to that supply chain. I also include energy in that. As I said to Secretary Ross today, what is the point of being able to be energy independent if we aren't willing to demonstrate that independence? We are a net exporter of oil. However, we still import oil. I think there will be a long look after this at what is it that makes America exceptional, what is it about our economy that keeps us safe, and what supply chains deserve greater protection. And I would say to those oil workers, you're on the front line of keeping us secure, because I'd rather use the peaceful tools of energy development than the weapons of war any day to keep Vladimir Putin at bay.
Thank you, Senator. Next question comes from Jack Durr, who's not here today, but this comes in a very high-tech way right here. But thank you, Jack. What are the penalties for not cooperating with contact tracing? The state health officers' confinement orders, if someone tests positive or has had close contact and they receive either a quarantine order or a isolation order, the orders say you must cooperate with health authorities to contact other exposed people to prevent the spread of COVID-19. So it says you must cooperate with, as we've talked about before, violations of health officer guidelines are infractions, up to $1,000 fine. But of course, we haven't had to issue any of those because most individuals, when they find out they're positive, they actually care about all the people that they may have been in contact with. They understand that they may have a disease that may not be deadly to them, but could to others that are vulnerable. And so we've had outstanding collaboration, cooperation, participation from people on identifying as best they can through their memory of who the individuals were that they may have spread this to. And again, I think that's the answer to Jack's question. I believe what's partly driving this, again, we've said the only thing that travels faster than the virus is misinformation, and we've all been about facts, not fear, but it is a fact that on Care19, the contact tracing app, that is a completely voluntary app. It's completely anonymous. You don't have to enter your email, your phone number, your address. It assigns you a 36-digit random ID number. You can delete the data at any time that's in there, and you can delete the entire app at any time. You are not required to share that data if you're contacted by a contact tracer, but it can be an aid for your memory to do that. And again, so it's completely at your discretion whether you release the data. The state health department, the state of North Dakota, does not have that data and is not trying to get that data and does not have access to the data on Care19. And so again, but it will provide you if down the road you've been to a bar, you've been to church, it's next September, and there's people that test positive, and you've been in those locations without knowing who you are, the Care19 app could send you a notification to say you've been someplace where there's been an outbreak and alert you. So again, it's for your safety and other safety, but again, finds, I think, the correct balance between protecting personal privacy, which was a central design point for that application, unlike some others. Those of you that might have Google Maps or anything else on your phone, if you've ever used it to try to go where you want to go, that also uses location services, which everything else, dozens of apps on your phone today are using location services. This does it, but in a much more private way. So again, hopefully that answers Jack's question and what might have been driving it. Now I'm going to go back to questions in the room. I'm going to go Amy and then Jacob.
Ethanol, if the Agriculture Commissioner wouldn't mind.
That would be awesome. Thank you, Amy.
I just had two real quick questions. First of all, do you know off the top of your head the number of ethanol production facilities in North Dakota?
Yes, a number of ethanol facilities in North Dakota. There are 5 of them. There's Richardson, Underwood, Falkirk, I guess we call it. We also have Dakota Spirit, which is just east of Jamestown. And then you have the Hankinson plant and you have the Castleton plant.
And then do you know, or can you just talk a bit about how ethanol production has changed during the course of the pandemic? And I don't know if you even have any figures as to how much it's decreased here.
Well, I may not be the expert on it, so bear with me. Probably some of the greatest things that have happened to the industry itself is when we started to see the breakdown in energy prices, and certainly crude oil is a driving factor in the cost of gasoline. And when we saw less traveling across this nation, we saw less energy use. We all of a sudden saw the price of gasoline and crude oil come down. And then when we saw the little mishap here recently, when you had traders that were sitting on contracts, and we got to the end of the month and those contracts had to convert, they physically could not take possession of that contract or what's in that contract, which a small contract on crude oil would be 10,000 barrels, 42,000 gallons. They had to pay to get out of them because they couldn't take it physically, so that sent it underneath. That even drove the market down more. And what happened was a bushel of corn will produce about 2.8 gallons, 2.7 gallons of ethanol. And when you see ethanol selling for 89 cents, and you have operating costs, you have the cost of production weighed into that, all of a sudden you are not even getting close to breaking even. And that has caused some turmoil. The other thing that happened in all this, 40% of our ethanol facilities in the nation shut down. So we saw distiller grains, which was a primary feed source being utilized in the livestock industry, started to get pulled from different areas. That started to send the price up dramatically, in some cases 300%, which really caused a bigger hardship for our livestock producers, especially the ones locally, because our plants were still open. That stuff was being shipped out. Now you would think with that equation, well, ethanol companies may be doing well. Not necessarily true, because when they were sending modified or a wet distiller grain out the door, they had very little cost in it. Now they actually had to dry it down. They had more energy cost into it before they could send it down the rail to those customers that were willing to pay significantly more for it. Yes, sir, Jacob.
Any concerns, or I guess, where would North Dakota's ethanol industry be without the recovery plan?
I think they'd be struggling. Hankinson right now, as I understand currently, has shut in for just a brief period of time. I think they're assessing their situation. A couple other facilities have actually, I believe they are running at 80 or 90% capacity. They're trying to just keep their legs underneath them, buy a little time. But I would probably go on the flip side of that question: what would happen to the ag industry without our ethanol industry and without this program? Right now, I would tell you as a corn farmer, I believe it puts somewhere between 50 and 70 cents a bushel on every price of corn, on every bushel of corn, because we have ethanol in our backyard. I remember raising corn when we didn't have ethanol, and our basis was extremely high, and we didn't even produce that much. So since ethanol has been here, it has put a floor added stability for the farmer.
For some context, motor fuel demand is about 50% of what it was here.
Thank you.
Yeah, I believe that they're saying gasoline consumption now has reached levels that are approaching the 1960s, which is just hard to comprehend because of the population of our country versus the 1960s, the number of cars, number of planes, the number of everything. It's just really hard to, again, this will be a economic case study that will be taught for 100 years. This is going to be March and April of 2020. I also want to say on ethanol, to give a shout out, I'm not sure if all 5 are doing it, but I know Thoroldson in Castleton is one of the North Dakota businesses that's stood up and switched their business model a little bit, and I know they're producing hand sanitizer, because of course hand sanitizer is mostly alcohol and ethanol. An ethanol plant is like some of the world's largest stills. It's like it's what it is. I mean, they're making alcohol, turning in creating alcohol for aka ethanol. So that's great. Other questions before we wrap up? Dave?
Senator Kramer. I'm just curious if, because of the demand for the first Paycheck Protection Program, and it looks like the demand is still very strong for the second one, is there going to be a third one, and maybe other incentives as well?
So the question is, is there going to be a third tranche of paycheck protection? I think right now most members are in a discovery mode, if you will. The Senate's going back into session Monday. We'll have votes Monday night, and we'll be there next week. One of the main points of discussion beyond doing some legislating, mostly in the area of confirming presidential appointments, will be exactly what's next. What will a COVID-19 recovery phase 4 look like? A lot of that will be determined by how well the first 3.5 tranches go. Paycheck protection was, is, and probably will always be one of the most, or the most popular component, because it's doing what it's designed to do. Again, I real credit to the lenders in North Dakota for distributing it so well and for understanding the rules so well and being out ahead of the game. And that's a real tribute to them and to our small business community. But, you know, the biggest challenge now with the Paycheck Protection Program isn't even going to be running out of money in the second tranche. It's running out of weeks because it only pays for 8 weeks. And so, you know, there's a little disconnect with the unemployment insurance dates, which run through July 31st. Paycheck Protection runs out on June 30th. But it does give us an opportunity to see how it's all going, seeing how the programs are working, seeing what the needs are going forward. There will be 2 very high priorities, I think, in the discussions for the next round of assistance. One is near and dear to the governor's heart, more near and dear to other governors than to ours probably, and that is, of course, assistance directly for states and local communities. In the first round of the CARES Act, there was a pretty generous distribution of funds directly to states. However, it was pretty confined. It was restricted to COVID-19 costs only. And the minimum for a state was $1.25 billion, and that's what North Dakota gets or would have gotten or received. And then recently, the Treasury Department released some of the rules, relieved them a little bit because the unemployment insurance piece was so high and such a burden on states that it seemed appropriate that money could be used for state reimbursement for their costs. And I think that was adequate. It was a good call. I think we advocated heavily for it. In the next round, however, there are many states, not all states are created equal. Not all states get to be North Dakota. And so the demand for more generous federal funding to not only cover the cost of COVID-19, but also replace lost revenue as a result maybe of the downturn in the economy, maybe as a result of COVID-19, and other ills that states might be living through, going through, whether it's recently or less recently, is the debate of the day. And we'll be watching that closely because that's a high priority for Democratic members of the Congress. For Republican members of the Congress, a very high priority is relief of liability for small business, medium-sized business, large business, entire industries, local governments, healthcare workers, because with this rapid development, with the rapid distribution of trillions of dollars have come, the ambulance chasers looking for opportunities to cash in and finding clients that they can service, whether the client knows it or not. And so we will be looking very closely as Republicans at liability reforms and making sure that we don't create a more litigious society, but rather a loving society, Governor, and one that understands that where we all understand that all of us from the poorest among us to the richest among us to the bureaucrat among us, and that includes even politicians, some empathy even for politicians, that we would be looking to give each other some grace, not to sue each other. So those are going to be really high priorities going into it, Dave. But remembering, too, that a lot of the CARES Act dollars, they're just getting implemented. The Paycheck Protection Program is very fast. Unemployment insurance was very fast. It didn't seem very fast if you needed your money today, but as government goes, it was warp speed. Same with the distribution of the stimulus checks or direct deposits. But the other bigger programs that are leveraging credit facilities and things like that designed to keep the economy at least humming, those are just getting kicked off, and we'll see how effectively those are. And then see, of course, how getting the economy back going plays out.
If I may, yes. Since you mentioned that those federal dollars are just now being implemented recently, in this letter that you and some of your colleagues sent to Secretary Mnuchin and Chairman Powell, you said that larger banks, quote, continue to use their market dominance to financially discriminate against legal and compliant businesses for political reasons. Wondering what evidence you have to support that.
Okay, everybody get yourself some popcorn and pop. I'm about to entertain you. There's lots of evidence, and it's cited in most of their policy statements that the banks have. It's cited in their annual reports, in their responses to pressure that they receive from institutional investors. So let's start with BlackRock. BlackRock is the bank the investment firm that is assigned to the CARES Act. They are the main advisor, really the facilitator of the CARES Act. BlackRock has a very strong policy against investing in fossil fuels. It was, when I brought that to the president's attention, he was a little surprised by it. But Chairman Powell assured me just this week that BlackRock's corporate policies will not influence the CARES Act or the Federal Reserve, that industry neutrality, as long as the industry is a legal, compliant industry, like, say, the firearms industry, coal industry, the oil and gas industry. But J.P. Morgan Chase has announced that their objection to investing in several fossil fuels. Wells Fargo has. Just this last week, there was an announcement by one of them, and I'm forgetting which one. Might have been J.P. Morgan. I'm not sure, but they announced that they would not invest in anything in the Arctic. The Arctic is often where their bias begins, because the Arctic sounds romantic enough from afar that that they can sort of get by with that. So no, it's widespread, well known, and they're not bashful about announcing it.
Okay, maybe a couple more questions. We'll go Lane, and then we'll go online for a couple, and then we'll call it a day. Lane?
Governor, in reference to the locations picked for field hospitals, first, is the Fargo Dome still set up, and for how long, if so?
To my knowledge, the what I call the rehearsal staging that was set up both here in Bismarck and in Fargo Dome, that those cots are still there. And that was, again, work in conjunction with the Army Corps of Engineers that was tasked with building field hospitals around the country. We have no model and no projection and no evidence that would suggest that we would ever need to have anybody set in there, but those cots are still there.
Secondly,
and so how long it'll be there, I don't know the answer to that. I mean, I'd say as long as necessary. Fargo Dome's is one of the things we talked about yesterday that's not eligible to be holding large events right now, so it's no conflict. And of course, that's a facility owned by the City of Fargo, and the City of Fargo has been a great collaborator through all this. But I'm sure that what we have in there could be moved out faster than they can get the AstroTurf up after a football game. So I don't think it's going to slow anything down.
and Governor, if I can.
Sure.
With those locations, are they going to go on the same guidelines as all other large venues, or are they going to be kind of held separately since they are those selected for potential field hospitals?
I don't think there'll be any conflict, but good question, Lane, on that one. We haven't thought that through about the ones where we've got pre-staged some equipment, but I think they'll all be on the same timetable. I mean, if we're back up opening up large events, I think that means that we've cleared any potential or even far-reaching possibility, or small percentage possibility of ever needing those minimal care facilities in those large event arenas. Okay, online.
Mike Smith, 660 KUYZ in Williston. Has the state completed testing in every long-term care facility at this time? And if not, how many have been done and how many are left to be tested?
The answer, the first one is no. I don't have the exact stats on how many we've done and how many have remained, but I know that we've got a goal that by the end of the first week in May that we will get through all of them, at least on the first round. Because places where we have counties in North Dakota, as you know, that have long-term care facilities. We have counties that have not have any active positives. We have other places where we've got long-term care facilities. I think we were at 27 yesterday, where either a staff member, 27 out of 218 long-term care facilities have either a staff or a resident that has tested positive, and our focus really is on all of those right now. And what Chris Jones is up here talking about is making sure that if we get a positive in a long-term care facility, that we are within 24 hours making sure that we got appropriate isolation to protect the staff of the long-term care facility and all the folks that are, if you have 1 out of 100 that's positive, we want to protect the other 99. It's about risk management, and we've got the capacity and the resources to do that. But I think I'm not sure if we're releasing that data, but I don't know it off the top of my head. But good question, thank you. By May 9th is the goal to complete all the testing. And again, I'd say that's a goal. Maybe I'll challenge the team. Maybe we can even beat it if if we can get our testing capacity to keep moving up. Another question from online?
April Baumgarten, the former Fargo Moorhead. Governor Burgum, when do you plan to go to a restaurant for dine-in after restrictions are lifted tomorrow, and which restaurant will you choose to go to first?
So April, if when I don't know how many days we're on here where we've been at the Capitol for 40 plus days in a row. So there's a lot of places I've thought about going, and a restaurant wasn't one of them. But I am. I so want to say so I don't have any plans right now to do that. But I'm happy that we're getting people back. Back able to do that, and appreciate the question. But it gives me, and part of it, I guess I hadn't thought about it, so it'll give me something to think about tonight or tomorrow. I say maybe I should go to, go out for breakfast at the little cafe at 8 a.m. tomorrow morning or something here in Bismarck. I don't know. It'll be Jacob.
4 days, but who's counting?
Okay.
I have a question for the senator again, please. Democratic colleagues have been calling for another round of these stimulus checks, and this time boosting it to $2,000. Wondering if that's something that's needed or something you'd support.
Well, again, Jacob, what I would say is we need to see what the situation is after we see how the first $3 trillion worth of stimulus and investment goes. And the $3 trillion is only the appropriated amount. The balance sheet, or the Federal Reserve's gone from about $4 trillion to $13 trillion before the CARES Act, and so there's a lot of liquidity out there. So we'll have to see how that all plays out. I would say there, of all of the things that there could be in the next round, direct stimulus to families is probably one of the more politically popular ones. It's interesting because the initial, stimulus checks went to people at a time when they certainly needed the money but couldn't go anywhere to spend it. Now that the economy's opening up, not just here where it's always been open, Governor, thank you very much, but in places where it's been much more locked down for obvious reasons and for good reasons, it'll be interesting to see actually how people's spending habits, what restaurants they're going to go to, whether they even go to the restaurants, whether they'll wait and see how their neighbor does before they go. All of these things, we'll have to see how it plays out to determine whether there would be a demand for something like that or not. But politically speaking, it is always popular. I think presidents as well as members of Congress don't mind doing something like that if, in fact, it would, quote, stimulate the economy. But right now, the economy doesn't necessarily need stimulation as much as it needs healing so that the free market can actually work.
If I may quickly,
sure.
Because this is now going to, tomorrow it'll be the second time that rent is due under many states being shut down. Is there at least a sense of urgency behind getting this program formed?
Yeah, I don't know that the calendar is going to determine that necessarily. I do think it's opportune that we're going back into session now because while it's been good practice probably to stay away when you're from 50 different states and your routine is to go home and come back every week. We're kind of a bad petri dish. But it is important now. It's time now for us to get back to work like our frontline workers are and look at all that and see whether there's a sense of urgency or not. A lot of it will be, like most things, there'll be some anecdotes, but they'll largely be decisions based on data, and we'll see what the data shows in terms of what the need is and then what the supply would be.
Thank you.
Okay, we're going to call that a wrap. I want to thank Lindsay for I don't know if any of you have signed for an hour and 25 minutes straight, but she's got great stamina. Thank you, Lindsay. Thank you, all the media that's here. Thanks for the online questions. We'll see you tomorrow at 3:30, and as we head into May Day and the reopening of those businesses under the new North Dakota Smart guidelines, again, I would say to all the customers, be North Dakota Smart yourself, and of course, and drive safe. Enjoy the beautiful weather, and thanks for being here together. Thanks to Senator Kramer. Thanks, Commissioner Goring. Thanks, Chris Jones, for being part of the program today. Take care, North Dakota.